Hello, my name is Lindsay Shuck. Thank you for joining today's Family Office Network's webinar series. I would like to take a minute to introduce our speaker today, Dr. Henry Legier, who also goes by Hank. Hank is a South Texas native who grew up in Austin and San Antonio. He attended UC Berkeley, where he majored in chemistry and economics before going to Columbia University in New York City for medical school. He completed his immunology fellowship at Harvard Medical School with faculty appointments at Mass General, Brigham and Women's, and Boston Children's Hospital. While on faculty at Harvard, he ran the immunology division at MIT Medical. Hank is here today to share his platform, the architect of the MDBox Enhanced Telemedicine, and offer the investment opportunity to scale their growth and execute on existing contracts. At the end of today's presentation, we will have time for Q&A. Please use your questions chat option to send over any questions you have during the presentation. With that said, Hank, I will let you take it from here.
Thanks, Lindsay. Hopefully y'all can see me up in the little video box, but I'm also sharing my screen. And what I want to introduce is what we call enhanced telemedicine. So when I set out to create this platform, I wanted to do something that was very different from what Teladoc, American Well, MD Live, large traditional telemedicine providers offered. I felt that what was really holding telemedicine back was the quality of data that providers have access to when you're communicating only via text or only via phone call or only via two-way video. And so I wanted anybody that uses our platform to have access to a cost-effective solution, an on-demand solution, but I did not want it to compromise the quality of care. So we've assembled a set of tools, Bluetooth devices, manual devices, and Wi-Fi integrated devices that allow for folks either in their homes or at remote pods that we've equipped to be able to transmit medical quality data, whether it's an image of the eardrum, an image of the back of the throat, skin findings, like for bed sores in nursing homes, remote dermatology visits, pre-surgical visits, allergy testing at remote sites, that would have the same level of data and detail that you would get in a doctor's office during a face-to-face visit, but doing it in a remote way. So 2020 was going to be our big year pre-pandemic, and we had done successful pilots with Walmart and with HEB in Texas, and we were offered basically 2,000 Walmart locations, 274 HEB locations, and a number of other big retailers that I'll show you later. And so we were planning on launching in 1,200 locations in April, 10,000 locations by now, and 23,000 locations by the end of 2020. Pandemic disrupted all of that, and rightfully so. Grocery store pharmacies didn't want to disrupt the grocery business by having sick people walking through on the way to the pharmacy to be tested for flu or coronavirus, in a pharmacy setting. So we postponed that rollout, and basically the pandemic allowed us to pivot in a meaningful way to accelerate the development of our remote patient monitoring platform and create an end-to-end a la carte pandemic solution with symptom monitoring, automated triage, telemedicine visits, integrated testing, health passport generation for governmental agencies, first responder organizations, schools. I'll show you all the traction that we've had with this. And then now that people are getting into this new normal, we've re-engaged these retailers and we're back on track. We're launching next week with 3 different retailers across the United States, and we should be in 10,000 locations by mid-year 2021. So it's been a lot of progress and a lot of ups and downs, but I think overall 2020 is going to be a banner year for us. And it is our first year at revenue. So we started this company about 5 years ago, and it was a lot of development of the artificial intelligence engines, the machine learning, building out provider networks so that we could be nationwide. And we were set to deploy April 1st. And so we deployed April 1st, but we were not in all those retail locations we expected. So I'll show you the traction that we've had in a shorter period of time. So what I mean by enhanced telemedicine is that we can go into a pharmacy or we can go into a human resources office and train a layperson to act as a telemedicine extender. And we worked with Jones Day on a state-by-state regulatory policy that allows us to do this in a compliant fashion. And so it can be somebody like a school nurse, team trainer, and even chiropractic clinic staff for integrated practices. And so what we do is we invite them to a training portal, and they complete all of their HIPAA training, privacy policy training, and they learn how to use our software. They learn how to use the devices that we've integrated with. And it takes anywhere between 1 and 4 hours, depending on the level of background that they have, how quickly they can get through the HIPAA training course, and whether or not they pass their tests. And then if they fail, we reinvite them to review the videos and take it again. And then the visit types that we're live with include everything from a general visit, medication refills, sports physical exams. Our bread and butter when we did the Walmart pilot, was sore throat, UTI, and influenza. And then since then, we just kept adding visit types and onboarding new visually read tests, and then also integrating with lab partners so that we can send people to labs, send people for x-rays, and do as much as we can at some of these pop-up sites that we organize. And so then obviously we also have things like pink eye, vomiting and diarrhea, birth control, hair loss, smoking cessation. Weight loss isn't listed here. There's many, many other visit types that aren't listed. Around COVID, we have 3 different user experiences. Somebody from home can just do an integrated COVID visit, give recommendations, and then we help navigate them to the appropriate locations. But we're working with the City of Austin now. As of a couple of days ago, they formally announced that our group is taking over all public testing in the City of Austin. So as of Saturday is our first go live for that. We did a pilot with them a few weeks ago on Saturday and did about 600 people in one day. And so there, it's just PCR collection. And then as we get deeper into the disease process and the prevalence is higher, and people have started to seroconvert, we'll be doing more on-site serology antibody testing. And that's why I said it's an a la carte end-to-end pandemic solution. We offer about everything from start to finish that you can think of in regards to the pandemic. And not just this pandemic, our platform is now poised for the next one that comes along. Right now, there's an H1N1 that's brewing in China that looks like it could be a much more serious disease than the one that we saw 6 years ago. And so if that does hit us this flu season, we'll be poised to handle that. We offer home-based daily symptom monitoring. I'll show you that. We coordinate and schedule testing events for churches, governmental entities, employers. We offer saliva, oral swab, and nasopharyngeal-based PCR tests with still about a 36-hour turnaround, but what we guarantee is 48 to 72. And we're the only FDA rules compliant finger prick serology testing platform. All other FDA approved finger prick, serology tests are venous blood draw. And then we've also integrated both the enhanced and the simple telemedicine visits for all of the different visit types. And a thing that we've had a lot of traction on lately is working with professional sports leagues and universities and youth sports to generate dynamic health path sports. So you have to do your daily symptom monitoring even to be allowed to go to practice. And at baseline, there's a PCR test that's required. And so this is what the enrollment looks like. It's basically 2 paths. If somebody is registering a group, a payer, an insurance plan, an employer, we generate a custom URL for them, and they pay us per member per month. If somebody goes to covid19.mdbox.com, and any of you on this call can do that right now, that's free, and you can register yourself and your family. And actually what I'll do is I'll share that just for a second. Let me go to my sharing options, and I'll quickly walk you through it before I go to the next slide. So I usually do Zoom presentations, so I'm trying to familiarize myself with where the presentation is here. So I'm not showing anything, and I'll go back to sharing. Lindsay, am I sharing again? Lindsay, can you tell me, am I sharing?
All looks great.
Okay, perfect. Okay, so let me come back in here. And what I want to do is open a new window. And I just want to show you this covid19.mdbox.com. So this is publicly available. You can go here, register your family members. Whether you like our investment opportunity or not, I would suggest that you enroll your family members on this. And you can see the states we're live in. It's 43 states as of yesterday. Arkansas rolls out today. And I've already created an account, so you'll see what it looks like if you've already done that. It's just going to have you log in and show you the family members that you've enrolled. So I've got myself, my wife, one of my daughters, and I can add another daughter. And then you can see how we create the sub-accounts and do consents. And then now I'll go back to my deck and go back to present. There we go. And so I'll show you what happens is you get these daily text reminders to check in with the monitoring program. And on a day-by-day basis, we're reassessing you for risks that you might have had. So any known exposures with people that are positive, if you're violating, some of the social distancing recommendations, if you're a frontline worker, you've changed your jobs, you went from remote working to now you're a cashier at a Walmart and you're seeing 500 people a day, all of that's taken into consideration, your symptoms and your vital signs. At bare bones, we want to know your symptoms and your temperature. And then based on that, we generate rules-driven triage recommendations. So there's stay home and stay healthy. That means that nothing's going on with you. Or, kind of continue to go out with normal socially distanced recommendations. Stay home, continue to monitor symptoms. If you've got mild symptoms, but you're not likely to need testing, we just want to watch you for a couple of days. It's not severe. And then there's severe symptoms, go to the hospital, go to urgent care, schedule with your PCP. And then kind of in that intermediate bracket's our sweet spot where we tell people we'd like them to connect to a telemedicine visit, or we could help navigate the testing that's available to them in their area. And if folks want to use a different telemedicine platform, they can, but obviously we make it very easy to use ours. So just download the MDBox app, you push it. Now this is all web-based right here. This is not, nobody's downloaded an app at this point. This is just based off of them pushing that button here where it says MDBox, check in with the monitoring platform. And once they download the MDBox app, they can either do it web-based or they can do it in-app. And then once they've downloaded it, it no longer says download MDBox, it just says push to connect to MDBox. And again, if we recommend testing, we recommend the testing based on where they are in disease. So this is all following CDC, NIH recommendations. There are some custom use cases. We're working with the state of Texas and the state surgeon general, where they're customizing what their recommendations are for some of their staff and employees. We're working with the Texas Air National Guard, Virginia National Guard, and their chief medical officers create their own customized recommendations on testing, and then we just program it into the app. So in most cases, if you're at home and you had an exposure and you're really early on in the disease process, we're recommending PCR testing, and we help you find it, whether it's by oral saliva, oral swab, or by nasopharyngeal testing. And then if you're later in disease, say you're at day 17, you had a known exposure 2.5 weeks ago, you did have some symptoms that started 9 days ago, but now they're starting to get better, we may recommend that you do both PCR testing and antibody testing, or we might just recommend antibody testing depending on the use case and the epidemiology. So, and then we actually drive you to a location where that's available in your area. And frequently those are operated by us. Sometimes it's public health agencies, other hospitals. But we've got that grid built out nationwide. And then our telehealth platform is our own provider network that we custom built, our proprietary EMR that's 4 years in development, that's high trust certified and meaningful use compliant. And we offer both flat fee, no insurance, or we'll process insurance. And so really what makes us better and sets us apart from other telemedicine providers are some of the tools that allow you to do these enhanced visits. And so we've integrated with over 120 different Bluetooth devices, and that's ongoing. We want to be device agnostic. So if there's a better device that gives better data at a better price point, we want to be able to work with that and offer that to our patients. And there are some hospitals that already have a preference on devices. Omron's a really popular brand. And so it's just nice to already have those integrations done. And that includes things like smart scales, blood pressure cuffs, pulse oxes, stethoscopes, otoscopes, dermatoscopes, exhaled nitric oxide, spirometry, and glucometers. There's a ton of other devices. We also have a preferred relationship with TytoCare, which is an Israeli company. They offer a home version of this product for $300 at Best Buy. And anybody can go purchase this, and then they can do ear exams from home, images of the back of the throat, that kind of thing. And you select your provider from a list. And so we're one of many on that. There might be 30 or 40 providers listed on that, but there's only 4 national telemedicine companies: Teladoc, us, American Well, and maybe MD Live. I forgot what the fourth one is. But then it's a lot of one-off small hospitals, regional hospital systems. What really sets us apart on that front is that we've done a professional version integration, and there is only one other organization. It's Ochsner has done a professional version integration at some of their outpatient clinics, but it's not very well utilized in terms of how you allow somebody to start a visit from home and then complete it at a remote site, and then potentially you're walking out of a pharmacy with a prescription. So we have a very unique use case, and I'll show you that we're actually the only national telemedicine company, or actually the only practice that has done this direct integration, so that when I use these tools in that setting, we're the only practice that comes up as a choice, as opposed to the home version where you get many different practices. So another thing that sets us apart is this proprietary machine vision that we've developed. So any visually read test, we can improve the sensitivity of it by about fourfold, anywhere between fourfold and 20-fold. And so like a pregnancy test, ordinarily you look at it, there's a line present. If it's not present, you're not pregnant. But that's not necessarily true. In the early days, they'll tell you, use this as early as 7 days. But you're pregnant in those first 7 days. You just can't see the line yet. And you're still producing beta HCG, and our machine vision can see well below the limit of human eye detection. And we've developed tests for SARS-CoV-2, COVID-19 antibodies, as well as just in-app instructions on how to collect the saliva or how to perform a nasopharyngeal swab. Rapid strep, flu AB, H1N1, UTI, colon cancer is now ready. We have this enhanced pregnancy one that's ready, drugs of abuse. And we're co-submitting to the FDA with one of the largest manufacturers in the world on both a urinalysis test and a COVID antigen test that's combined with flu A, flu B. And we're hoping that approval hits the market this coming flu season. So we've gotten very good feedback from the FDA on that. And that's through a partnership with a large manufacturer. And this is how the machine vision works. So you can see up top, we put a little green box where there is actually a line there. You can't see it very easily. If you don't see it, don't worry. 10 different doctors that we asked to look at it called this test negative, but we knew it was positive because we diluted the flu B below the limit of human eye concentration, but we knew the antigen was present at a very low concentration. And then we magnified it over on the left. And again, if you can't see it, don't worry about it because 10 doctors couldn't see it. On the right, I show you what we do. We actually create this vector orientation field analysis through a curve filter transformation that we invented. And that literally can see the geometry of the nitrocellulose field. So as antibodies are binding protein and that conjugation reaction is taking place, we're actually realigning the geometries on that nitrocellulose pad. And then we put a little light filter over it. That's a computer vision filter. And then it just lights up. And so it makes it very easy to see the unseen. And once we've trained our machine vision, it takes us about 3 days and 10,000 images. It's 99.9% accurate. In fact, we would call it 100% accurate, but the FDA won't allow us to do that. And in the last 30, 40,000 images, it has not made a mistake when we've done it against validated known controls. In terms of the recent traction we've had, a lot of this is in the last 2 to 3 weeks. It's been amazing. We've signed the city of Austin. We've got contracts with the state of Texas, the U.S. Air Force, the National Guard, Hayes County. We're back on track with these big retailers. The ones on the left are the ones that we're back on the planning calendars. So we're still on hold with Walmart and H-E-B during the pandemic, but the other ones that are listed on the left are actually either live or we have go live dates. And then we've signed within the last couple of days, Creighton University, Florida Atlantic, UConn. I know that there's a few other universities that are in contracting right now. And then we signed with Injury Free, and that brings on several 100,000 kids onto the platform. Now, fall sports might be delayed, might not happen in some states, but in some states they're definitely happening. And there are actively right now teams practicing. And so as of 2 weeks from now, they will be required to be on our platform just as a part of showing up to practice. Every day you have to show that you have an up-to-date dynamic health passport. And if anything changes on it day to day, we make those dynamic recommendations: go get tested, stay away from practice for a week, whatever it is. And so we've had traction with professional sports leagues that we've signed that go live in the next 2 weeks. We've had traction with college athletic associations. There's a couple of big conferences that have signed contracts in the last couple of days, and with some film and movie production studios, as well as some individual productions. So if any of you guys are fans of the streaming series The Chosen, season 2 is coming back because of us. We're going to be able to get them back on set, and they're going to start filming here in another 3 weeks. And it should be about 2 months of production. And so hopefully by the end of the year, there's a season 2. And then in terms of like where we stand on our supply capability, because we have a 5-year relationship of building this platform with some of these test manufacturers that make these lateral flow tests and other more complicated tests, we've been co-submitting for 3.5 years with 2 of the companies, and for almost 4 or 5 years with one of the companies. We've been able to negotiate a right of first refusal on American product. So when you hear of these big shortages that we're hitting states early and continue to some extent, we haven't had that issue. And that's why we've been able to become a vendor for the state of Texas and for other military organizations like the Air Force and the National Guard. We provide both the in-home collection instructions for the saliva PCR tests, and those will be live at, there's about 2,000 locations nationwide that distribute Topco brand. And basically in the pharmacy section, you'll be able to buy these in-home collection kits. I don't know if it's quite going to be September. I think we've accelerated that. That might be in the next 10 days. And it'll be co-branded with Topco, powered by MDBox. And then you basically, it's kind of like 23andMe. You spit in a little tube until you get to a certain line. And then we'll turn those, there's an envelope that has a FedEx label on it. FedEx has negotiated with us to make that very cheap, but we pass that on to the consumer. And then as soon as it hits the lab, it's about 36 to 48-hour turnaround. So if everything is done smoothly, it should be less than 72-hour turnaround. And then any negative results will be conveyed in the patient portal. Positive results, we recommend it's conveyed by telemedicine. And we'll give them notifications that if they're ready to have results viewed both by text message or in-app messaging, depending on patient preferences. In terms of our intellectual property portfolio, I've got a wall of patents behind me that are different from these ones that are listed, but we had about 20 awarded. We've got about 8 licensed. Interestingly, epidemics tracking on a mobile device is a patent we applied for about 5 years ago that we have granted. So almost everybody that's doing contact tracing through these handoffs with geofencing and Wi-Fi and Bluetooth exchanges is stepping on our intellectual property. We met with our firm, and we decided not to go out and actively prosecute people during a pandemic. It looks bad, and also as a doctor, I just don't believe in that. Like, I want to allow people to be taken care of and get through the pandemic. But after the pandemic, there's a giant opportunity for us to go out and flex a little bit. Some companies have already come to us. Their patent attorneys told them that they were probably infringing. One of those was Funware. They were not originally in the medical space. They built a similar platform that allows people to be very, in a geofenced manner through these handshakes targeted for political messaging. And so it probably helped Trump's campaign last election cycle. And they modified it for health tracking and were awarded some large government contracts. And then when they found out about us, we negotiated a partnership with them. And so I think they did a press release about maybe 3 or 4 weeks ago announcing the Funware MDBox joint venture. But we've got lots of other intellectual property. We've got patents granted for combining a flu test with a COVID antigen test. So that way you don't have to wait for the PCR results to come back. It's a 15-minute test that should be coming out this flu season. That'll be huge. We'll be able to sell any test that we make. We've got a patent granted, but we're not manufacturing it, for a combined pregnancy test with Zika virus testing. We just don't have the the funding for it. Frankly, we have so much opportunity and so much that we've developed that we really, based on our state of our finances, we're targeting specific contracts and deployments so that we can get to profitability before we, or raise more money before we target some of those other opportunities. And where we stand right now, we're live in 43 states. We added the 44th today, so I didn't get a chance to update my deck this morning. We just turned on Arkansas. And the 5 more states are coming out in the next 3 to 4 weeks, so we'll be at 48. Alaska and Hawaii have just been very complicated from a regulatory and also even recruiting point of view, but by the end of 2020, those will be live. Thus far, our average wait time across our network is still less than 4 minutes, and we continue to support English and Spanish, but we're working on other languages as well. We're trying to raise 20 million at 100 million pre-money valuation, and we have a nursing home opportunity. Those revenues come into the company, but the nursing home is going to, they want a lot of customization, and so they're going to be funding their own customization. So when I talk about how use of funds are allocated, this 20 million we're trying to raise won't go towards this nursing home customization, but it's 200 nursing homes, and the company that manages them has 70 that they directly own. And so we're going to do a 5-location pilot, scale that to 35 within the next 6 weeks, and then we should be at 70 locations by the end of Q3, and then all 200 locations by the end of the year. And each one of those locations should generate several $1 million in profit per year. So I think it's going to be a giant opportunity for us. And now I'm going to stop sharing this for one moment, and I'm going to actually just share my my phone and my my iPad if I can figure out how to do this. Let's see. So I want to share a device now instead of sharing it with Zoom. You can share devices, and I guess this is the one thing I'm not sure we figured out. Do you know, Lindsay, am I capable of sharing an iPad or an iPhone that's hard connected?
I'm not sure, to be honest with you. I know that when you change the presenter, maybe it would go back to when you select the Google versus.
Oh, okay. Let me try that. And so, like, since I'm plugged in hard to my phone, if I have that up, so I'll go back to
That would be my thought.
change presenter. Yep, and then. I'm not coming up as a presenter choice, maybe because I'm already the presenter. Let's see, I'll stop showing screen and then I'll try again. Change presenter, nope. I'll try, oh, here I go. When I show just a window main screen. Well, I don't know that it's gonna let me share a connected device. So maybe what's better is to take questions. And then if anybody wants to see a live demo, I can set it up one-on-one. Let me do that. I'll just go ahead and I'll take questions at this point. And then if anybody wants to schedule with me to do a live demo, I'll actually walk through exactly what it looks like to log in as a patient remotely on the platform, to be sent to one of these remote sites. You know, basically we give in-app map directions. They show up there, they check in. There's a telehealth extender that's using an iPad that's trained there on site. And then they just follow the step-by-step instructions, and they're doing things like performing tests, or they're using these devices to capture the medical grade images of the back of the throat, the eardrum, the heart and lung sounds. In the nursing home, we're able to use the vision system to be able to look for bed sores and things like that.
Perfect, great, thank you, Hank. Just FYI, we are seeing a different screen now. We are seeing a background of like the ocean with some rocks. I don't know if that was the new device you were looking for.
Oh, no, that's just my computer.
Okay.
What I was wanting to do is actually show I don't know how to get it to show my phone or my
Gotcha.
iPad. Yep.
Okay, so Wayne has a question. And again, please use your questions chat option to send over any questions that you have, and that way we can answer them accordingly. But Wayne was wondering if you have any mental health applications as well.
We do have a visit type that's rolling out for mental health, and it's a comprehensive wellness platform. It's licensed, so it'll be through a partnership, but they're live in 50 states right now.
Great, thank you. So far that's the only question we have. We will wait a little bit here to see if any other questions pull through. But Hank, if there's anything that you wanted to add in the meantime, that would be great as well.
Yeah, I guess the one thing I would say is that there are certain things I can't yet share about where we're at with some other companies and deployment, but it's very, very likely that we will be partnering with a different large Israeli company, not Taito, and doing a massive retail partnership with their device linked to our telemedicine platform. And the thought is that we'll finalize the terms of that business arrangement within the next 2 to 3 weeks. And the expected go live will be Q1 of 2021. And other than that, I think I was pretty comprehensive in terms of where we are, in terms of where the revenue is coming from. We just got started at revenue this year, and to date, we booked about $6 million in business. But just those signed contracts that have come through in the last 2 weeks account for, taking the nursing home out of consideration. The city of Austin is a 4-week deal for $3 million, and that's guaranteed. And then after 4 weeks, it re-ups. And so potentially it could be $3 million a month. And then the Texas Department of Emergency Management right now owes us about $750,000 for tests that we've sold them, but they just put out a big bid for a $200 million contract. And when they made their public notification 2 or 3 days ago, for anybody that Googles TDEM, you'll see that Abbott Labs was listed, Curative was listed, and we were listed. And so they were just making public disclosures of companies they're already doing business with. And so we've been talking to the head medical officer for the Texas Department of Emergency Management. He also happens to be the head of Austin Public Health, and he was the one that awarded us the City of Austin deal. So I know that we are in a pole position for pieces of that contract. It's such a big problem, not one person's going to get the entire contract, but we're thinking we're going to get a very substantial portion of that contract. And then we were awarded an Air Force grant and contract that we've been awarded but has not yet funded. And so realistically, there's probably just our business that we've done and our contracts that we have somewhere between $10 and $20 million just through this date this year. And then the nursing home deal alone, and then those universities, the Youth Sports America, I mean, it would just be extrapolating what that revenue is. But we have that in our data room and our pro forma, so that folks that do want to dive into our data room, that's all modeled out there.
Thank you so much, Hank. Irvin, he says, he may have missed it, so he apologizes if you already said it, but if you could please comment on how large your paid user base is and the pace it grows.
I'm sorry, the patient grows?
The paid user base and the pace that it grows.
Yep, so it's changing dynamically. So as of this morning, there's different ways, because it's an a la carte platform, we have patients that come to us in different buckets. So it's close to 100,000 people doing symptom monitoring and some aspect of testing. On the simple telemedicine, where they don't go to enhanced visit sites, they just download the app and they just do a connection, it's about 17,000 people. For folks that are licensing our software, so we offer this to medical practices, and they have their own office key, and instead of leveraging our provider network, they're leveraging their provider network. A single practice in Houston has a couple 100,000 people on it, and it's 15 doctors, and then they've got 40 nurse practitioners, and that's just a different revenue model. We bill them on a per provider per month basis, and then they're doing their own billing and collecting. And then we've sold a couple of million tests to folks, and now we've got contracts for another 5 to 6 million tests that we have to do out over the next couple of weeks. And they're just these kind of one-off contracts. It's like Crichton University, Florida Atlantic, UConn. And so each one of them comes with different patient populations and different services. Some of them are not using the telemedicine, they're only buying tests, but then they're having their results on our lab information network. And if it's positive, then we recommend a telemedicine visit to see them. And then going online in the next 4 weeks is going to be this whole Youth Sports America program, where anybody that participates in youth soccer across the country, Rugby USA, USA Soccer, Interscholastic Sports Alabama, and then a professional league, and then some other collegiate leagues, they're going to be required to use our platform. And so at that point, the patient base is going to be somewhere between 500,000 and 1 million. It's going to grow very, very fast. In terms of accommodating that, we're part of the Amazon Health Accelerator. We're basically a cohort of 8 companies. And so if you go to Amazon Health, we're actually listed there in the AWS Health Accelerator profile, and that allows us to basically infinitely scale our AWS needs as on demand, and it's dynamic so that we're using less when we need less, and we're using more when we need more. And then we also, through a partnership, collaborative agreement with Google, have discounted access to some of their machine learning tools.
Thank you, Hank. Let's see, any other questions? We would love to take them now. We'll give everyone a few minutes to see if there's anything else that they'd like to ask.
Yeah, and then anybody that wants a copy of the deck I presented, Lindsay, you can distribute. And then also anybody that wants to reach out directly to me to schedule a one-on-one live demo, totally willing to do it. It takes about 20, 30 minutes, depending on how complicated we want to get. It can be as little as 2 minutes where somebody's just getting tested and then they wait to get a test result. And it can be as long as 35 minutes if I really take my time talking them through all the features of what we built, because it's very different from any other telemedicine platform. We utilize machine vision, machine learning. The diagnostic engine creates a rank order ICD-10 list of probabilistic diagnosis, and it auto-suggests treatment plans to make it very easy for our providers to get started on their notes. So instead of taking 10 minutes, 15 minutes charting, on average, they can get a very comprehensive note done that's customized, and it's not just a template that's done in somewhere between 2 and 5 minutes. And so it helps them see more patients, and it's just a kind of a pleasure to use, and I like showing it off.
Fantastic, thank you. And we did have a few people write in saying that they would like the deck and some more information. So we will be following up with all of you individually. There doesn't seem to be any other questions at this point, but if anything comes to mind, please feel free to reach out to myself or Hank directly. We want to thank all of you for joining us today, and we do look forward to connecting with you soon.
Yep, perfect. Thanks, guys.
Thanks, Hank. Thank you, everyone. Have a great day.